Hi everyone, my name is Isabel Anya Free. I am a diabetic nurse specialist working in the UK. I'm equally a student at the University of South Wales. Today I'll be presenting on the topic microvascular diseases, specific diabetic peripheral neuropathy. I'll be presenting this in fulfillment for the requirement of a postgraduate diploma in diabetes. Microvascular diseases is a term used to describe conditions that affect the small blood vessels of the body. Diabetes is one of the major causes of microvascular diseases, and complications that arise as such include retinopathy, diabetic retinopathy, which is when the blood vessels supplying the back of the eyes get damaged. We also have diabetic nephropathy, which is when the kidneys get damaged, and diabetic neuropathy, which is when the nerves of the body get damaged due to excessive amounts of glucose in the body. So diabetic peripheral neuropathy is a type of diabetic neuropathy, and it's the most common of the diabetic neuropathies, which affects about 50% of the people with diabetes, both type 1 and 2. It is a situation in which the nerves are damaged. The nerves of principally the feet, the leg, the arms, and the hands, they get damaged due to exposure to high blood glucose levels. And this occurs when the nerves, there is change in when there is high blood glucose levels, there is change in the nerve chemicals, which in turn alters the ability of the nerve to transmit signals. Typically the causes of diabetic peripheral neuropathy is common to causes of diabetic neuropathy and all the other types of neuropathies. And one of the main causes of diabetic peripheral neuropathy is high hyperglycemia, which is high levels of glucose in the body. It is seconded by a long duration of diabetes, which means the longer you have diabetes, the higher your risk of developing diabetic peripheral neuropathy. Also, other risk factors of having diabetic peripheral neuropathy is hypertension, high cholesterol and triglyceride levels, smoking, alcohol abuse, age, and sometimes hereditary. Diabetic peripheral neuropathy has symptoms which sometimes go unnoticed by the patients until when the nerve damage gets severe, and then the pain is excessive. But the common symptoms of diabetic peripheral neuropathy are tingling sensation, burning sensations, muscle weakness, hypersensitivity to touch, loss of sensation to pain and temperature changes, severe cramps or severe pain, muscle weakness, inability to walk on uneven surfaces. Also, these patients sometimes may have foot ulcers, foot infection, or wounds on the foot, principally because they have lost sensations to the feeling of pain, and sometimes will not notice when they have an injury. And this is one of the causes of leg infections, which leads to disability and sometimes amputation. I think that is all when it comes to the symptoms of diabetic peripheral neuropathy. So if you are diabetic and you feel the symptoms or have the symptoms, I'll advise you to pay a visit to your general practitioner or your doctor. In the United Kingdom, the National Institute for Health and Care Excellence recommends that people with diabetic neuropathy are screened for people with diabetes rather are screened for diabetic neuropathy upon diagnosis of type 2 diabetes, or 5 years after diagnosis of type 1 diabetes, and then 1 year thereafter on a yearly basis. So I'll go straight on to preventive measures and management of diabetic peripheral neuropathy. So if we're looking at the preventive measures and the treatments, we are looking at targeting the risk factors and also the symptoms. So high blood glucose levels is one of the major risk factors of developing diabetic peripheral neuropathy. So we will ensure, as a patient, you want to ensure that your blood glucose levels are well controlled. You're adhering to the anti-diabetic medications that have been prescribed by your doctors. Also, you want to be taking your antihypertensive medications as prescribed. You want to be taking your your cholesterol medications as prescribed as well. And if you are smoking if you're smoking, I advise you to stop smoking, because this increases the risk of developing diabetic neuropathy. And there are studies that show that smoking is an independent causative factor for diabetic peripheral neuropathy. And if you take too much alcohol, you want to be reducing the quantity of alcohol you consume. Also, I'll advise that you do some lifestyle modifications, like eating healthy, doing some exercises. These both are very effective in helping to control the blood sugar levels and hence reduce the complications of diabetes. I also like to talk about food care, which is very important for people with diabetes. So I'll advise you, if you have diabetes, to always check your feet on daily basis, and wash your feet with lukewarm water. Ensure you dry them properly, especially in between the toes. You do daily inspection of your feet, especially in between the toes, for any cracks, discoloration, or anything that you may find abnormal, and report to your GP if you find any immediately. Also, I'll advise you to moisturize your feet daily, but avoid moisturizing in between your toes. If you're cutting your toenails, or if you're cutting the nails of your feet, make sure that you cut it straight across and not into the nail bed, to avoid injuring yourself. Also, never ever walk barefooted. And if you're putting on shoes, ensure those shoes they're properly fitting, have no cracks. Thank you for watching. That will be all.